what makes somebody a woman, would you say?
They can have a baby.
There are women that can't have babies. Are they not women?
Well, yes, they are, but they have.
So it's not the fact that they can have a baby. So what is it?
Well, I guess that they would have the ability to have a baby if they were healthy.
Well, but there are people that they can't, and it's just something that happens at birth, but they're still healthy.
Hey, sorry about that. I'm in the car.
Yeah, no problem.
How are you doing?
Doing great. What did you want to talk about?
What game are you playing?
Oh, bro, this is good.
Playing Clash.
Oh, no. This is Chrono Trigger. Clash of Clans. This is Chrono Trigger, baby.
Oh,
one of the best games of all time.
Oh, I thought you said two columns. I was thinking Clash Royale. Sorry, my bad. Can you hear me okay? I'm actually in the car. I hope my signal doesn't go out so you can hear me okay. But I was curious to hear from you on your number one point on your list.
Okay. Sure. Yeah, go for it. Why don't you go ahead and repeat the number one point for everyone to hear?
Yeah, I think it says trans women are women and trans men are men.
That's correct. All right. So
I was curious. Yeah, I was just curious. What has that always been the case, or have things changed socially or culturally to where that is a new idea, or has that kind of idea always been, I guess, true in your understanding of it?
Well, I believe that that we've had the study regarding human hormones. I think like we first started realizing hormones were even a thing. It was roughly around 1890, where we removed the gonads of a rooster and found that it exhibited chicken-like properties, or it started growing chicken-like properties because of the lack of testosterone. And as studies had gone on, we had recognized that humans are quite similar in that way, that if they don't get specific hormones, they can exhibit male or female characteristics. And given that that there were instances that they could observe hormones. I think this was around like the 1970s, where they realized that there are people that end up having different hormones than what is typical of their sex. And then it causes there to be transgender characteristics effectively, right? And this exists both from a social aspect down to a like an intersex aspect. It explains both in that way. Right. And so we haven't been aware of it, I guess, the entire time, but we're certainly aware of it now. Does that make sense?
Gotcha. Yeah. Just full disclosure, my position would probably be the opposite of yours, which is fine. And I think it's a good topic to have a discussion on. I want to better understand your position. What might cause someone to want to transition?
Yeah, so,
I don't know the right way to say that, but I don't know if that's the right way. I don't want to be offensive or anything. What might cause someone to transition?
Yeah, so one thing that I've noticed is there exists a series of hormones that absolutely influences the way somebody behaves. Actually, let me rephrase that. We don't know which one causes the other. Does the behavior influence the hormone, or does the hormone influence the behavior? It's kind of hard to tell in certain cases. But the point is that hormones and the behavior are correlated. We're aware that one of them causes the other. We just don't know which one it is or which order it comes in. And so the end result is that at an embryonic stage, let's say that you're developing as a baby, you're an embryo, and you're developing, everybody starts female, right? However, it is through the presence of testosterone that basically will turn the female into a male baby, right? It is only through testosterone. And so when it comes to, like, for example, somebody who's XX chromosomes, as in female, they can actually receive hormones. They can receive hormones that are opposite than what is typical at an embryonic stage. They could actually receive testosterone, the synthesis of testosterone through androgen responses, which then causes the person to become more male, right? In some cases that exhibits an intersex characteristics, and other times it just happens entirely within the brain, right? And so that exhibits its way towards female to male. As for male to female, there exist XY chromosomes that end up getting a lack of testosterone, right? And so sometimes they end up developing into, a male anyway, but inside their brain, it is more female than normal. Does that make sense?
A little bit, yeah. I'm trying to follow you. I think I hear what you're saying. So are you saying essentially that this is an overgeneralization, but essentially they're born that way?
Yes.
Can you hear me?
Yeah, I can hear you. Yeah, I said yes.
Are you? Oh, sorry, it cut out. It cut out on my side. I apologize. Okay, so essentially you're saying that they are born that way.
Mm-hmm.
And then is it at some point that they have this realization that they are the other expression of gender?
I'm sorry. Can you repeat that? I was really excited that I just killed one of these golems. I'm so sorry.
No, it's okay. Golems are big. So
golems
I'm sure
suck, dude. These golems suck. I hate them. They're awful.
Yeah. So you would say they would be born that way, and then at some point have an actualization that they would need to be the other gender, for lack of a better way of saying it. Would you say that intersex, though? Side note: would you say that being intersex, that is a disorder?
Being intersex,
genetically, it's a sexual genetic disorder.
It is a disorder. I guess like the problem is I'm not a big fan of like, I don't know, like if somebody is born like a specific way, like, yeah, it's a disorder, but I don't like disparaging people about it. Does that make sense? Like, it is a disorder.
Yeah, for sure. Yeah, absolutely. I wouldn't want to do that either. I'm just talking about in general on paper. This isn't the ideal way for the body to function in this way, correct? Like, it's not the healthiest way that you would want to necessarily have.
Well, it's not really their choice. That's the, like.
Yeah, exactly. Yeah, exactly.
You can't really do anything about it.
Right, but you would say it's a challenge and a disorder should someone be born that way.
So like the other thing that I'd like to think of is like just the social instance of it. I'm of the belief that I think that people, as long as you're not harming other people, do what you want. And I would extend this out pretty a lot. Right. And so like, if I'm talking about, let's say, for example, that there is a trans person that doesn't actually exhibit any of these disorders, but they still want to be trans because I don't know, it could be a social contagion. Let's assume that they're just looking at a lot of pro-trans stuff and then they're like, oh, maybe I'm trans. Okay. If that was the case, right, and like they wanted to socially transition, I would have no issue with that either. I would still call them trans. I would just respect them. Does that make sense?
Yeah, I hear what you're saying. Yeah, as long as they're not hurting anybody or anything or themselves, then you would be fine with what they choose to do.
I died in the game. I'm sorry.
Oh, it's okay. Moment of silence for that.
No, you're good. You're fine.
Yes. Okay. Well, I think that's fair. My position, personally, I'm just speaking from my own personal opinions and understanding, which is limited. My position would be that it would potentially seem harmful to yourself depending on how far down the transitioning road you take yourself.
Yeah, I mean, like me personally, I think if you're going to have any drugs, anything like that, I think what you have to do, I think it's really important that you see a therapist right? And a lot of the times, like when it comes to gender affirming care, 90% of the cases literally just stop at the therapist, right? Because they realize that this person doesn't actually have gender dysphoria. And, you know, a lot of the times, you know, it can be just literally social media. And in that case, right, all right, no big deal. You could socially transition. A lot of the times they grow out of it. Right. But then there's the 10% where that's definitely not the case. They have gender dysphoria. They need medication. Right. And so like situations like that, I think is really important to acknowledge that, like, OK, it's not a social contagion in that instance. You need to make sure that they get the proper treatment. Right. And I think like we're currently like making laws on the books that say you can't do this. You know, that minors can't be like, you know, brought into like, they call it even like experimental, even though the current medical consensus is to treat gender affirming care with gender affirming therapy, which is exactly what I've talked about.
Gotcha. Okay. Yeah, that makes sense. I'm trying to think of where I would want to better understand, and I don't know enough, where someone would be born with the genetics that would make them want to, or that would make them trans, for example.
Mm-hmm.
Now I know you talked about can you explain again in the simplest of way how someone is born with the proclivity to be trans?
Yeah,
because that would be the opposite gender of their birth, of their birth assignment.
The hormones in their brain is not analogous to their genitals.
The hormones in their brain.
Mm-hmm.
Even though their chromosomes aren't either, correct?
Well, yes. That's a whole nother can of worms. There are people who are like XY chromosomes, but will grow a full vagina, boobs, hips, everything. They would not be the wiser that they are XY chromosomes. The doctor literally pulls a baby out, sees a vagina, and goes, woman, you know, or girl, right? You have a baby girl, and that's it, right?
Yeah. Yeah.
And like the problem is that, again, like a person that is XY male, it is possible that they end up not getting testosterone as a baby or as they're growing. And so they end up having all of the female parts, all of it. I mean, if you looked at these people, you'd be like, that's a female. You wouldn't be like, that's a male.
Could they get pregnant? Do they have the uterus?
Yes, they do. Though, if I'm not mistaken,
they have a uterus.
I'm pretty sure that these people can't have children, but I'm not aware if there is an instance where they can have children. Let me look that up real quick. Give me one quick second.
Yeah, it's fine. Take your time. Now, would you say that's common, or would you say that's pretty rare, depending on the results of what you're looking up?
It's rare. It's rare, but it does happen.
Okay.
Hold on. Sometimes hold on. Let me just.
Go ahead, take your time, and then I have some thoughts on maybe my position. Love to get your thoughts on.
Yeah, hang tight. Okay, yeah. So generally, no.
Okay, so generally they don't develop a uterus per se.
No. They there are instances where they can, but there are numerous complications that make it impossible.
Gotcha.
Yeah.
To get pregnant.
Yes.
Got you. Okay. So, from my position, my opinion is that, you know, a woman is someone who has a uterus and can have a child, and then a man has a penis and can fertilize the egg that the woman carries. So I know that's maybe you could say the traditional position.
Mm-hmm.
Now, within that, I would very much suggest that just because that is biologically happening, male and female express themselves very differently.
Yes.
There's a wide spectrum of expression of male and female within their biological, for lack of a better way of saying it, their biological sex. So for me, it's a jump that even though someone expresses themselves maybe in a wide variety of ways, it's a jump for them to claim that they're the complete other biological sex. But I still acknowledge that people express a lot of variety, which is totally fine.
So when it comes to like sex and gender, they're two different things. The sex doesn't change, right? So a person can be, you know, a male, right? But like it could just be hormones in the brain, or hell, it could just be like entirely social and have nothing to do with that. And so that would be the difference in gender, right? Because gender is just going to be like the set of phenotypical characteristics as well as like, you know, cultural differences that make somebody female, right? It's not like you're like pulling people's pants down and looking at their genitals, and you're also not checking like if they have like XX or XY chromosomes through like a blood test, right? Yeah.
Yeah, but a trans woman wouldn't be able to get pregnant like a woman would.
Well, there's women, correct? there's full women, right? Like their sex is female who can never have children. That happens all the time.
Yeah, for medical reasons that are normally preventing it from happening. But let's say a healthy trans woman cannot get pregnant.
Let me look that up.
Because normally the women who, you know, can't have babies, they're you know, there's problems in their ovaries or in their uterus, which is preventing the egg to attach, or whatever the case might be. Mm-hmm. So they're not, you know, thankfully there's technology to help with that.
As of now, it's not possible. As of now, but
so I guess I would ask, why would they consider themselves a trans woman? Well, okay, so what you're saying is, well,
because the sex is different from gender.
Got you. I never understood how those separated, even though I do grant that people express themselves in a lot of various ways, which is totally fine and good.
Like what makes somebody a woman, would you say?
They can have a baby.
There are women that can't have babies. Are they not women?
Well, yes, they are, but they have.
So it's not the fact that they can have a baby. So what is it?
Well, I guess that they would have the ability to have a baby if they were healthy.
Well, but there are people that they can't, and it's just something that happens at birth, but they're still healthy.
But I hear what you're saying. So
like older women can't have babies. Like as soon as that they go through menopause, does that mean they're not women?
No, of course they're still women.
Yeah.
So the division of the expression and the biology is how you're saying a trans woman is a woman and a trans man is a man, because there's a division between the biology, what you're capable of doing biologically, and then how you express yourself.
Mm-hmm. Well, I mean, like, you have to ask yourself, what is it that like makes somebody like a woman to you, right? I mean, at the end of the day, like, we're not looking at, you know, genitals. We're not looking at, you know, whether or not they're XXXY chromosomes. In fact, I've met many a woman that exhibit very many male characteristics. In fact, some of them much manlier than me.
Yeah.
Like I'm not the manliest dude you've ever seen, right? Like let's be honest.
Yeah. Yeah.
Okay.
Yeah. Oh,
so what I think is that like we look at like a series of characteristics, right? It's just like we look at like, okay, what does their face look like? What clothes are they wearing? What you know, what are the typical things that we can expect? Where is their fat placement? You know? And then it's the combination of those things that make us think male or female, right? But that doesn't necessarily mean that their sex has changed, right? Just because those phenotypes, that those are the external characteristics, don't match, right? And so there's a severance between like what we perceive as them being that to like what they were born as, right? Which is the severance of sex and gender.
Yeah. Yes. Now, let's say you by your own admission said maybe you're not the manliest of men, which, just for the sake of the argument, would you ever consider wearing a dress? And I don't know you. I'm just saying, like, for the sake of the argument.
Not really.
Okay.
Do you think I'd look cute?
Yeah, that's fine. I'm not. So let's say there's other guys like.
I would kill in it. Tuss says I would kill in a dress. I agree. I would kill in a dress. I would look great in a dress.
Now, just because someone feels more feminine doesn't necessarily, would you agree, doesn't necessarily mean that they would need to wear a dress.
That's correct.
Like, I guess I'm trying to understand the thoughts of a man, for example, who maybe is more feminine, which is fine.
Well, they end up feeling, because they have this discomfort of their body. Sorry, go ahead.
No, I was going to say, let's say they feel that, and you look around and, don't feel as manly as other men. That's fine. Nothing wrong with that. I guess I would ask, well, what takes them then to really go down this journey of, well, actually, I'm a woman, I'm not a man. Maybe I'm not a manly man, but I'm actually a woman and I should wear a dress.
From what I've heard from other trans people, it's like it's this persistent discomfort that happens when they are they're assigned sex at birth, right? They feel like that they're like, this is not the right body that I was born in. And they can't explain why. They just know that they feel comfort when they push themselves to going into the opposite direction, right? They get comfort, they get a euphoria. Thank you, Rook, for the $5. I really appreciate it, bro. You're amazing. You do not have to do that, by the way. You donate like every single stream, dude. That's amazing. Sorry. All right. Anyway, Pet Cheetah.
You're good.
They feel this a euphoria by going towards the opposite gender, right? Like by wearing dresses. Let's say, they were born male. By wearing dresses, long hair, makeup, they want to present themselves as female, right? And it's not necessarily like a sexual thing. Do you see what I'm saying? And so like, it's something like that I would absolutely encourage that, you really should talk to a therapist to see if you can get like, to get assistance, right? To see if you really do, if you really are, want to make that step, right? Because there's a lot of barriers to entry here, right? Specifically with hormone replacement therapy, even after 18 years old, especially in my state, the state of Florida. Oh my God. Ron DeSantis is horrible, man. That's crazy what he's done. Like people who are 18 can't even get like gender affirming care. It's crazy.
Once they're 18. Yeah.
No. Even after 18. Like they said that it was like that they're doing it to protect children, but it wasn't about children. They didn't care about children. It came down to they just wanted to suppress trans people. That's really what it was. And it's so sad to see that.
What do you think their concern is?
I think what it is that they don't actually have a concern. I think like specifically with Ron DeSantis, and I did read Ron DeSantis's book. What was it called? Let me pull up the title. I read a lot of books. I all of these titles, they just start to meld together. Just give me a second while I pull it up. I read Ron DeSantis's book. Give me a quick moment. I swear these politicians, they all have very similar titles, like How to Be Free, or you know what I mean? Yeah, this one's called The Courage to Be Free. By Ron DeSantis. I read that book, and the way that it read made it seem like that he knew. Beauregard Bo, thank you for the $1, bro. That is amazing. It appears to me that Ron DeSantis knew that he needed to get votes. And the way that he figured that he could get votes is if he subjugates a specific minority and creates alarmism among like parents and people who are who typically vote, he could actually get elected. And that's exactly, I think, what he did and what he played on. And it seems to be alluded to in his book when I read his book. And so I think that he's using the transgender issue as a cudgel in order to get what he wants. Right. And like, it's actually kind of interesting because like when it came into like the local elections in Florida, he was successful in doing that, but working on that platform didn't work from a national stage because most people aren't anti-trans in other states, but they certainly were in Florida. In fact, most people didn't even know about trans people until Ron DeSantis.
Oh, wow. And that brings up a good point, because I think my personal concern would be that gender affirming care, potentially, from my very limited non-medical understanding and my own research,
Mm-hmm.
could be harmful. I know that's a big word.
Mm-hmm.
And here's what I think. Even as an 18-year-old, because I take Zoloft for anxiety.
Yeah.
I take some sleeping medicine, and actually, you know what? Now that I'm older, it's had a good effect. I know when we put these on kids or younger people, even an 18-year-old, to be honest, that their body's still forming, and it can potentially have a lot more side effects.
Mm-hmm.
So that's my worry. That's my worry is depending on how intense the whether it's hormone therapy or, well, of course, reassignment surgery. That's very serious operation. My concern is that could bring harm potentially.
What? I'm sorry. Can you repeat what would bring harm?
Well, reassignment surgery, I believe, is potentially harmful.
Okay, so sex reassignment surgery.
Yes.
Okay.
That could potentially bring harm.
So let me ask you this, right? Like if a person is gender dysphoric, right, that they would go as far to go to sex reassignment surgery. Do you think that, let me rephrase it. Let's try it this way. Is a boob job harmful?
I think it can be, yeah. I mean, I think sticking stuff into your body is not healthy for your body.
So, all right, let's break it down then. Is a root canal harmful? Because you're definitely sticking something in your body there.
Are they drilling stuff out and then replacing it with a filling? I forget what that is.
Yeah. So it's I'll show it on stream.
I mean, honestly,
I'll show it on stream. Give me a second.
No, you're fine. Honestly, I think there is a lot of dental work that is unnecessary, to be honest.
So I'll just show it real quick. What it looks like here. What, dude? I freaking hate modern websites, dude. As a web developer, anyway. Sorry. I'm going to share my.
I think a root canal is a very.
All right, so I'm showing you right here.
Okay.
Well, so like you earlier were making the argument that putting something in your body, right? That's a bad thing, right? And so I guess like I'm wondering, like you seem to make that argument towards a boob job. So then great, like it looks like that you've already agreed that like cosmetic surgeries, putting something in your body is harmful. But then I guess the next question is like, okay, well, here's something where you're putting something in your body. However, is absolutely medically necessary. So I'm showing you what a root canal is. Basically what it is that you have an infected tooth that has an abscess in the root. And so what happens is that they will drill a hole into the tooth, and then they dig out all the nerve endings. There's no more nerve endings. They completely rip that out. Then they basically put in some root filling replacer that's like got antibiotics as well as like a filling. And then they place a permanent filling or crown in order to like basically stop that abscess, stop the infection, and it stops the pain. Right. And so I guess like my question to you is, since you are putting in filling, is that harmful?
I would say, since it's so localized and and just in your tooth, not in your body, but in your tooth, it's very localized there. I would say that that's probably not harmful in comparison to the good that it will do.
Okay, fine. So fine. So then let me ask you this. Let's say if a person is disfigured from their face because they had a tumor extracted from their cheek, they now have basically half a face and a hole where there was, and so they can actually get cosmetic surgery where they can get all sorts of plastics and stuff to make it look like that they have a normal face. Is that okay?
Yeah, that's a good question. Probably. Would it cause harm in the long run? I don't know. I don't honestly know if it would cause harm over a decade or so.
Are you saying that like what you're concerned about is complications?
Yeah, I'm concerned about when you
Great.
modify
So
your body.
do you think that people should do you think that they should be aware of the risks prior to entering into a surgery?
Oh, for sure.
Okay. So then if they are
Yep,
aware of the
100%.
risks, is it okay? Let's say that they're aware of the risk. Let's say that they are aware of the risk and they say yes to a surgery. Is that okay then?
Still a risk for harm, and that they could be harming themselves. But yeah, they could harm themselves, and we harm ourselves all the time.
Yeah,
But
I guess I'm just
yeah,
asking, like, because to me, I'm thinking about it in terms of like, yes, all surgeries technically are harmful, but the question is like, okay, I think that they should just be aware if it is harmful or is not harmful, and then they can make an educated decision as to whether or not it's worth it to them, right? Because obviously, what might be worth it to them may not be worth it for you or I, right?
yeah, for sure.
So I think like
I
the
would
informed consent is like really important here.
argue, even though we can offer a surgery for even with informed consent, and that we have the medical ability to do it, I would still suggest that doesn't mean really it's good for us. I would suggest that medical
Well,
technology
that's not up for you to
has
decide though,
advanced.
is it?
Well, it's not. But what I'm suggesting is medical technology has advanced further than medical ethics, which is kind of a side note. But I would say anytime a top surgery happens, that's a little less risky than a bottom surgery. Bottom surgery seems potentially very harmful to your
Well,
biological.
I agree. There's a great deal of complications that happen from bottom surgery. I will grant that. But at the end of the day, I think that's a decision that needs to be made by the patient, who is then informed, right?
Yeah, I agree with that.
As
I
an
agree with
adult,
that.
I don't agree with bottom surgery for anybody under 18.
Yeah, I agree with that. I just would still personally, I
Mhm.
suggest that it still seems harmful potentially. But yes, I agree. You
This
can
is
choose
also a
to what
good
you.
point. Somebody had mentioned, they're saying that the regret rate for transition is around 3% on the high side, and the regret rate for knee surgery is 30%. So should we stop knee surgeries?
Well, I would suggest those numbers could be biased because of how socially contagious the trans movement is. So I don't know. That would be my
So wait,
response.
I guess like, I mean, what if I like grab that from relevant data? Would that, like if it was like from like the NIH or something, like, would that be
Well,
acceptable to you or no? Numbers
to me
don't.
personally, I feel like a lot of very influential medical communities and scientific communities are biased by government and big pharma and political gains.
Okay. So what if there was actually multiple institutions that came to the same conclusion independently?
That'd probably be helpful, but yeah, I mean,
Well,
that
yeah, I
would be
mean, like
helpful.
that's the case for like the NIH. That's the case for the CDC. That's the case for the Mayo Clinic. So now we have like multiple countries, multiple independent institutions coming to the same conclusion. And not just that, but multiple fields of study from sociology to psychology to neurochemistry, the neurobiology, the biology. All of these are in agreement of trans affirming care.
Yeah, I mean, that's a big statement. I would have to kind of,
Okay.
unpack and try to sort through all that. But I would still, personally, I don't trust it all 100%.
All right.
Because some of those agencies, I feel, have been also not trustworthy with other things.
Yeah. Well,
So,
okay. So like, here's the thing, right? Like I think about like, I look at things in a very empirical way. I look at like very, very carefully, like, okay, well, what is the current like medical consensus of something, right? Because like at the end of the day, you and I are not doctors. We're not trained medical professionals. At the end, I'm going to appeal to the doctors, and I'll read their reasoning, their evidence behind it, so it's not an appeal to authority, right?
yeah,
And so like, at the end of the day, if I basically go against them, then effectively what I'm doing is saying that like, oh, I know more than like these doctors that spend their life studying this topic, right?
yeah, yeah, for sure. I agree with you. Now, I do know that those doctors in the hospitals are very much pressured to subscribe to certain practices, certain ideologies from the top down that do influence their true opinion of said topic.
Well,
That's what makes it difficult.
so you would have an argument, but the problem is that this is operating at multiple different institutions independent of one another, finding the same conclusion, right? So this is one really either a really, really big conspiracy theory that spans world governments, or trans people are valid. does that make sense?
Yeah. Well, and again, I'm not saying trans people aren't valid necessarily. I'm just, trying to break it down and talk through the different potential risks
Okay.
of hormone therapy and reassignment surgery in particular. Because I
Well,
don't
you
think,
definitely sound more reasonable than most anti-trans advocates. I'm not saying you're anti-trans. It just sounds like you're asking questions, but
yeah.
you sound more
Well,
reasonable,
I
which is
care.
good.
I care about people.
Based.
You
Me
know,
too, man. Me too.
yeah, I'm just
Big time.
an average person. So yeah, I think when we have disagreements, it's okay to disagree with people, but just try
Mhm.
to listen. And I think you're better on the other side of it if you honestly just try to listen.
Mhm.
But I don't want people being harmed. I don't want people being hurt and all that. And it sounds like you don't either. So that would be a good place for most people to start.
That's cool, man. Do you have anything? Do you have anything else for me?
No, I appreciate your time. I really do.
All right. Well,
Hopefully
by
we'll
the end
talk
of this
again sometime.
discussion, I managed to beat the Golem twins. So, all right.
Okay, well, good. Good. That's a good accomplishment. So I appreciate your conversation.
All right.
Thank
we're gonna
you.
call it. Yep. See ya.